My name is Christine Tesmer, and this is my musculoskeletal neuro video. First, I would provide hand hygiene, provide privacy for my patient, and then go over and inform them of what is going on. This is Isaiah, who's going to help me today. First, we're going to do the upper extremities. So we'll palpate the pulses, the radial pulses, and make sure that they're equal. And then the brachial pulses. And then we'll check the strength of the hands. And so look at the joints, make sure there's no swelling, redness, no tenderness on them. Alright, and so you're going to flex your hands up, flex them down, and then we're going to rotate abduction, and then adduction, and then I'm going to test the strength of them. So I'm going to try to open your fingers, but don't let me open them, keep them together. So we'll try to pull. Now open them, and I'm going to try to shut them. Good. Alright. Now we're going to do the arm. And so with that, you're going to do rotate up, supination, pronation, and then also flexion and extension. And then I am going to push, and you're going to try to push against it, and we'll test the strength. So don't let me push them down. Alright. Now, push my hands down. Alright. And then we're going to do the range of motion of the shoulder. So with the shoulder, you're going to go all the way up, and then extension, go all the way back. Yeah, I'm going to do this one. All the way up, and all the way back. And then to check for the rotation, you can have them go sideways, so put your arm and go sideways. And then also bring it up like this, and to see if there's any tenderness or sores in there. The other one also, you reach back and touch your neck, and then also below, touch your back, to check for the rotation of the shoulder. With the arms, now try to push my hand in, push your arm in, and then try to raise your arm up. So that tests the range of motion of the shoulder and the muscle strength of that. And then we're going to do the lower extremities. So you're going to look for symmetry, make sure there's no abnormalities on that. You're going to check the joints for tenderness, any swelling. I have to stand up. The hair, any varicose veins, which all circulation is good. Yeah, I won't be able to see that very well.
I'll sit on the chair.
So you would check to make sure everything's symmetry and that there's no abnormalities on that, and check that. And then you're going to do the popliteal. You would check the pulses, which is back behind. And then you also have the dorsal pedalis pulses, and make sure that those are equal. And then also the tibial pulses, which are back here. And check and make sure that those are equal. And then you want to do the range of motion for the hip. You would have them, you may have to do this on the floor. You would have them extend their leg out to the side. You're going to have to sit down for that. I'm going to stand Can you stand and do? Here, I'll just move it down. So, yes. And then that. And then you would also cross over the leg and check and see, and cross the other leg over to check for the hip. To check for strength of that, you would give resistance to the leg as they push against it. Try to push against my hand with your foot out like this. You do that, which if they're laying on the bed will be a lot easier. And then you also do the flexion, raise that up, and then the extension goes back behind. Yeah, I do the other flexion, and then extension. And then for the knees, you can sit down now. For the knees, you would do the same thing. Now extend your knee out and flex it back, kind of back below. And then same with this one. Do the right and the left. Next. And then the feet, you can do the feet. I think you're fine. So yeah. Where you have them flex and extend, push it down. And then you also have them rotate around to make sure that there's no issues on both. And then to test the muscle strength, make a circle. To test the muscle strength, you're going to do resistance. First, you're going to have them, I'm going to do your knees first. So first on these, you'd have them push in and then push out on that. And then on the feet, you're going to have them, you can just relax because those should be able to see. You're going to have them push against and make sure they're equal, and then push up. And make sure that there is the strength on there. And then also turn your feet in, and then have them also rotate them out to see, make sure that it's all equal on that. Then we have the knee bend. So we're going to do the deep knee bend. So you need to stand up and then bend down like you're doing squats. And that checks the bending, the deep knee bend. And then the spine, when we look at the spine, we want to look to see that this concave and then convex and then back concave again. And so you want to make sure that is all aligned. So you're going to flex down, and then you want to look to see if this is equal and symmetry all the way down. All right, now stand, and you can also check the hips. Now bend backwards. This is the extension, just a little bit. Okay. Now twist. Turn this way, and now turn the other way. And make sure that there's no issues with that circulation. Also with the gait, you want to just watch them walk and watch their feet just walk normally. Make sure their arms are swinging. Make sure that the gait is regular. There's no issues with that. And then the Romberg test. With the Romberg test, you're going to have them stand with their eyes closed. And you can have them put their arms in front of you, put your arms in front of you, and see if their arms come down or if there's any swaying or any movement on that, which he's doing good on there. Now we have the Babinsky test. All right, you're going to come back here. But this is more of a sensation test. So we're going to look at his foot and see if there's any. The abnormality of this would be as if the big toe flexes and these spread apart, and they should not do that when you do that. And so you take something and you go from the bottom all the way to the top and make sure that that does it. Normal would be maybe a curving in, and then you can go on the side and then across the bottom. Let me see this one so they can see better. So we just go up, and then you go up the side, and that. And so that is a normal Babinski test for that. And so then we also have the rapid alteration. So you put your hands like this, and then you're going to put them down, and then put them back up, and do that as fast as you can. And this is to make sure that the rhythm is normal and equal. All right, now do where you touch your fingers and see, and then do that one as fast as you can. And you can also have them tap their feet too. Really tap their feet and see if the feet are the same. The other one is the finger to nose test. So you're gonna touch my finger and then touch your nose, and touch my finger and touch your nose. Finger and nose. All right, now do your other. All right, and then the other one is you're gonna take your heel and rub it from your knee down to your ankle, and then do the other one. And that just checks for that. Now we're gonna do the position of the finger, and that, put your hands out. I'm gonna hold this, and you're gonna close your eyes, and you're gonna let me know if I'm pushing your fingertip down or up.
Down. Up. Down. Up.
And we'll do the other side to make sure that they've got the same.
Down. Up. Down. Up.
You can also test sensations where you can draw a number, keep your eyes closed, on their hand and see if they can tell you what it is. You don't know where that was?
8.
Yes. And this also, then we also want to do the more sensations, and you can do that with like a cotton ball, like a Q-tip or cotton. You want to do the face, and so you can have, I'm going to use this. This is dull, and this is a little sharp. And you can touch the side of their face and ask if they can feel whether it's dull or sharp.
Dull. Sharp.
On their face, and then you'd also want to do it on their hands, which you can do the same thing.
Sure.
You could also do a paper clip, and you can separate it and ask if they feel 2 points or 1, which I do not have at this time, and see what their sensations are. And then along with their leg, you could do the 2 point versus the 1 point down their leg and on their foot to test the sensations to see if they feel the dull.
Dull. Dull. Sharp.
Sharp. And then for the deep tendon reflexes, I don't have the hammer, but what you would do with that is on here you can hit your thumb, and then you would look to see if there was a reflex when you hit that tendon on the arm, the brachioradialis, and then you have the patellar, which you're going to hit just below. Swing your legs, and then you're going to hit there to see if he's going to have a reflex with that, and see if those are equal. Then you also have the Achilles, which is back behind here, and you can do the same thing where you would hit that and see if there is the reflex coming from that on each one. You could also have them lay down and do it from the back and have it come up. Let's see what else do I need to do. And that concludes my musculoskeletal and my neuro exam. Thank you so much.